Well, good morning, good morning, good morning. Thank you for joining us for our Lunch and Learn series today. We're having a wonderful topic entitled Strategically Addressing Racial Injustice and Health Disparities in Our Community. I'm Lisa McDuffie. I'm the president and CEO of the YWCA of Northwest Ohio, and it is also of equal importance for me to acknowledge Jan Ruma from Healthy Lucas County and me serving as your Health Equity Chair, being able to bring to you this session to help us really increase our equity muscle in our community. Healthy Lucas County has been around since 1998. It is a coalition of community organizations working to improve the health of Lucas County residents. And most of you know the YWCA works to empower women as well as work toward the elimination of racism. So this is a perfect combination of two organizations coming together, again, just to educate our community so that we all may create a more equitable community. Today's session is coming to you from, I think, a wonderful, wonderful community pillar. We have Nathan Ziegler. He is a vice president in culture and inclusion for Bon Secours Mercy Health. I'm going to read just a little bit of his bio. It's quite impressive. He is the Vice President of Culture and Inclusion for Bon Secours Mercy Health, where he leads the strategic integration of diversity and inclusion across all aspects of the organization that has 60,000 associates and generates nearly 10 billion annual income revenue. As a leader in D&I for Bon Secours Mercy Health, he has deployed ministry-wide counsel for diversity and inclusion that covers all markets. He has developed education and training solutions to reduce bias in education inclusion and has helped shape D&I as a strategic priority for the organization. He is also heavily engaged in the community, helping to build sustainable partnerships that support all communities across the Bon Secours Mercy Health footprint. Mr. Ziegler is originally from Toledo, Ohio. He earned his PhD in educational psychology from the University of Toledo in 2015. He has a master's in education and a bachelor's in Spanish. With extensive career in higher education, business, and healthcare, Nathan has worked globally to build educational programs, deliver strategic D&I training solutions, and consult businesses and universities on their cultural and inclusive needs. He has been published, has been internationally peer-reviewed journal, and has spoken in over 30 international and national conferences. Nathan currently resides in Cincinnati, Ohio with his wife, Jen, and his 4 children. It is my pleasure to turn it over to you, Nathan.
Thank you, Lisa. Thank you for that warm introduction. It's really good to be here with all of you. I'm going to share my screen as I prepare to walk through some of the things that we're going to talk about today. So as Lisa mentioned, I'm the Vice President for Culture and Inclusion for Mercy Health, Bon Secours Mercy Health. Locally, we're Mercy Health in some of our markets, and some of our other markets we're considered Bon Secours. But our corporate entity is Bon Secours Mercy Health. I want to start with, what got us here today in terms of our strategy and how we are approaching this, crisis that's in front of us, this 400-year-old crisis that has certainly culminated in the events from the summer, but we must acknowledge what got us here in the past. So today I want to start with sort of framing our conversation around what is our healthcare system doing to address health disparities in our communities of color, and how are we looking at and addressing racial injustice and inequities overall? It starts with our mission. We are a Catholic healthcare ministry. Our mission is to extend the compassionate ministry of Jesus by improving the health and well-being of our communities and bringing good help to those in need, especially the poor, dying, and underserved. I want to start here because if you look in the first part of that sentence, extends the compassionate ministry of Jesus. Jesus, by example, lived a life of inclusion. He looked at injustices and wanted to eradicate the harm that society and cultures were inflicting on people. As a model for how we approach our healthcare, we want to continue to strive for that as an example for how we treat each other, how we engage with our communities, and how we ultimately are providing quality care to all people. Our values of human dignity, compassion, stewardship, service, and integrity are deeply aligned with a culture of inclusion. We know that inclusion is something, it's a muscle that we have to continually exercise. So we've developed a diversity and inclusion framework that helps us think about our diversity and inclusion muscle and how we're going to expand and ensure inclusion and equity for all people. We take the head, heart, and hands model by saying we need to build the intellectual understanding of what diversity and inclusion means, what racism means. How do we start to think about things from a different lens? But we also want to understand how people are feeling and develop the compassion or the emotional understanding of a different person's experience. But we believe ultimately what's most important is not just what we understand and how we feel, but what we do, the hands part of our framework. And so everything that we've been striving to do is situated around building that behavioral effort, the capacity to continually act on what we say and to continue to strive to achieve equity across all populations. We have core culture behaviors that guide our work. We want every person to feel empowered to bring their full self to the ministry. We want to be unified in our approach and understand that people have different perspectives, different gifts and values that they bring to the ministry. We want to be unified around those values. We also want to be agile in how we understand and approach different cultures and understand that people have different needs, that the environments and the things that are happening to people are changing. All of these together have been guiding our approach towards diversity and inclusion well before, for many people, was an awakening to racial injustice this summer. So I want to walk through sort of how we're defining diversity and inclusion, how we're looking at systemic racism, and then what we are taking, the actions we are taking to strategically address this issue. So we start with the framing of understanding diversity. Diversity is the existence of the gifts, talents, and attributes of people, processes, and functions characterized by both differences and similarities. We want people to understand that all people have gifts and talents that they bring to our ministry. We want to make sure that those gifts, talents, and attributes are flourishing. We also understand that people have dynamic attributes, intersectional identities. And we don't want to just call out one group or the other, that we all have unique gifts, talents, and attributes that influence who we are as people, how we process and work with information, and how we work as teams, and how we engage with different communities. It's characterized by both differences and similarities, because while we have these unique gifts, talents, and attributes, we also have points that we come together around. So simply put, we think diversity is who we are. It's something that exists in all of us. But what's most important is what we do with it, and that's inclusion. Inclusion is creating and fostering a trusting environment in which all people are included, respected, and supported to be engaged in the acceleration of our mission, values, and vision. Our goal is to make inclusion an intentional activity, an intentional exercise to ensure that people are represented, that they're contributing fully, and they're bringing their full self to the ministry. You've probably heard the example in other talks, diversity is being invited to the dance, inclusion is being asked to dance. We actually want to take that a step further and say inclusion is helping plan the dance, select the music. It's choosing the location and being involved in the profit sharing. It's also all the behind the scenes things that we need to ensure there's structural equity across the board. So our diversity and inclusion framework has been really designed to be something that is infused within our culture. In past work for the field of diversity and inclusion, our observation was it was sort of treated as an antibiotic. And I'm sure many people on the call have been in trainings and things where, somebody says something offensive, the diversity and inclusion team comes in and does a training. That's really an antibiotic approach. And while there are certainly instances where you need to take your medicine and you need to cure the illness, we want to build the muscle so that it's acting like a nutrient. It's something that makes our body stronger, something that we take on a daily basis and infuse to help ensure that we are a healthy body. So we've designed a diversity and inclusion strategic plan. We started this process in 2017, where we were tying diversity and inclusion across all aspects of our operation, our strategy, and our business. We want to ensure that we have a culture of inclusion where all people are treated with dignity and respect. We also want to ensure that our workforce mirrors the demographics of our communities, that we look like our communities. It's important for us to hire the communities that we serve. We also want to be relevant and engaged with all of our communities, that we're listening to what our communities' needs are, and that we're able to address and come to the table in a collaborative effort. We also want to ensure that diversity and inclusion is tied to our clinical care, that we're ensuring that all people are having quality experiences in their care and having equitable outcomes. And finally, we see diversity and inclusion not only as the right thing to do, but the right business thing to do. It's something that can help us grow and expand and be more innovative, more creative, and ultimately better at our mission of providing care to all people. So as part of that strategy, beginning in 2018, we started to deploy leadership councils for diversity and inclusion across our entire footprint. These councils make up cross-functional leaders that design strategies, tactics, and metrics that cut across those 5 areas in our strategic plan. In Toledo, we have a very active Council for Diversity and Inclusion that helps us understand what are the needs for this community. What do we need to do to ensure we look like our community, that we're inclusive of all people? What do we need to do to be better at our work? So the council really sits as a diversity and inclusion team for the market. So we often joke that our diversity and inclusion team is 4 people wide, but 230 people deep, because these are the individuals that are truly leading the work for us. But of course, over the summer, we saw a pivot. After the gruesome murder of George Floyd, Breonna Taylor, Ahmaud Arbery, we saw the diversity and inclusion framework from a new lens. And we'd been talking about strategic racism for some time, but to really shift our thinking as how do we get here and how do we erase these injustices? So a lot of times organizations look at diversity as something we need to go out and get, okay? And then we need to work on inclusion, and then eventually we'll get to equity. We actually want to flip that paradigm and say inclusion cannot occur until there is equity. Until there's equitable outcomes for all people, will they feel included? Freedom cannot be achieved until there's justice. People to be free to be themselves, to bring their whole self to the ministry, cannot be achieved until there's accountability for our actions, whether that's on the national or the legal level, or even just organizationally, that we have built-in accountabilities to ensure that people are held accountable for the actions so that all people can bring themselves to the ministry. And so all these beautiful, unique gifts, talents, and attributes cannot be realized until all of these things are in place. We need to build that foundational structure for equity, inclusion, justice, and freedom, for diversity to truly thrive. So that really guided our response to, what we see as really a 400-year-old problem. And what we want to do is start to really understand what that problem is, and then be strategic in how we're approaching it, that we're tying it still deeply in part of all of our things, that it's not an auxiliary response, that it's integrating into all of our operations. So we've been rolling out across our ministry several trainings and communications around what is racism. What are we actually talking about? If you look at the media, a lot of times people are looking at individual racism. Those are those beliefs, actions, attitudes, the comments on Facebook, what have you, where people are supporting either consciously or unconsciously racist ideas, racist behaviors. We often also think about interpersonal racism, right? These are the biased actions that a person takes against another person. They're typically the public expressions of racism. What we want to start looking at, though, is institutional racism. This is racism and discrimination that's occurring at the organizational level, whether that's in society or within a company, within school districts, within the government. These are discriminatory practices that create, and policies and laws that create inequitable outcomes for white people over people of color, specifically over Black people, and create injustices across the board. So we need to look at this at a deeper level. So we have to start with the origins of systemic racism in this country. You know, when the Americas were beginning to be colonized, it started with racist thinking, with racist intentions, where people were enslaved from Africa, brought to the United States. Their labor was exploited. They were beaten and raped and harmed. The indigenous population in the United States was pushed off their land, was killed and murdered. As we move into the 18th century and we see the Emancipation Proclamation by Abraham Lincoln end slavery, we still saw massive discrimination and injustices continue and actually start to tie across multiple sectors. So when you look at the Jim Crow laws, from 1860s onward, it created inequities in terms of people's right to vote, in terms of housing segregation, education segregation. And even after some of the segregation started to end, we still saw discrimination in terms of redlining and the ways that school districts and income levels are influencing outcomes. So essentially what we have is an unjust system where there's racist policies, practices, laws, programs that are creating an inequitable distribution of power for white people over people of color. So these racist policies, practices, and laws have created inequitable outcomes or racial disparities in housing and employment and education, life expectancy, incarceration. And we know this through data. We see the social determinants and really impact communities of color, specifically the Black community, in disparate ways. It cuts across education, food security, health outcomes. It cuts across all of these things, and we see that through the data. If you look at the median household income, and this is recent data, the median household income for Black and African American people is almost half of that of white people. And so when we start to see these disparities and what that means for outcomes and health outcomes, we have to ask the question, why are people underpaid? Where is this inequity coming from? And what can we do to address it? When we see infant mortality rates at more than twice as high for Black babies than for white babies, we know that and that's when we're controlling for things like education, income, housing, all these other factors that can impact infant mortality. We have a structural racism problem. We see it not only in health and economics, but we see it in the rates in which Black people are incarcerated. If you look at illicit drug use in the United States, Black Americans make up less than 5% of the population that uses drugs, but they represent 33% of those that are incarcerated for drug abuse. When we look at fatal police shootings by race, we see Black Americans are shot far more times than any other population. We have a national crisis on our hands, and it's cutting across all of these different sectors. We have to understand what is causing that. And those inequitable outcomes prime our thinking, our biases that we often talk about racism. And that then influences our history, our policies, and our practices going forward. So it's a vicious cycle. You know, the thing is, a lot of times people focus solely on bias as a singular part of why we have structural or systemic racism or racist outcomes. The thing is, bias is something that all people have. We are inundated with 11 million pieces of information at any given time, but we can only handle so much of that information. So our brain has cognitive shortcuts that help us interpret and understand the world. We also have unconscious biases and conscious biases. The unconscious biases are those beliefs that we're not necessarily aware of, the actions, the attitudes, and the behaviors that we're unconscious, that we have a reaction to something. Of course, we have conscious biases, and we're making decisions based on our conscious and unconscious biases all the time. But the thing about unconscious bias that is so relevant to what we're talking about is it's pervasive, it's happening, it's influencing everything we do. It's a distinct mental construct from other biases that we may have. So it's something that really sits alone, and it's something that we need to figure out. Why do we have these unconscious biases about people based on race, ethnicity, gender, sexuality, and so on? It may not align with our declared beliefs. And this is a really important point in this whole conversation, in my opinion, because a lot of times people say, well, I'm not racist. I think all people should be created or are created equally. And of course, they believe that in their heart, but their bias conflicts with that belief. And so what we want to do is get people to see this as something that is changeable, it's malleable, it's something that we can work on, and all people have to work on it. And the other thing is our unconscious bias favors our in-group. So when you look at who has power, who's holding power, our biases trick us into thinking that other people aren't disadvantaged because our bias is favoring our own in-group. So we have to be critical about the ways that bias is influencing these structures. And when we think about how do we address racism, systemic racism, and these racial disparities, we have to approach it by addressing not only the structure and the systems in place, but also our implicit biases. They go hand in hand, and we have to interrupt this cycle by approaching them together. And we do that by using an anti-racism lens. So, Ibram X. Kendi's book, How to Be an Anti-Racism, has greatly influenced our work in pivoting and really focusing on how do we look at racial disparities? How do we look at systemic racism in a different way? So using this anti-racist lens, we want to change the systems, the structures, the policies, practices, and attitudes so that power is redistributed and shared equitably. Our goal is to have a just society where all people are contributing and getting the same opportunities for equal outcomes. It also means that as an individual and as an organization, we need to be advocating against racism, and we need to be taking that intentional action to end it. We may see things that happen in our personal lives. We may see things that are happening in the news media and so on. But we have to be a part of that change if we want things to stop. And we also have to look internally and say, how am I, as an individual, as an organization, contributing to these racist ideas, these racist outcomes? If we think of structural and systemic racism as something that's influencing these disparities and these outcomes, we can look at how we're all participating and how we can all be a change agent in creating a shared equal distribution of power. And that comes by influencing anti-racist policies, by challenging each other, by challenging the structures and the systems in place so that we have that just system. The other thing that I wanted to touch on is a lot of times when we think about racism, we think about it purely at the surface level, the water. And when we say, well, the water's dirty and we need to clean the water, so we might put chlorine in the water bucket. What we have to do is say, why is the water dirty? What's the infrastructure that's harming our water? What are the pipes? What's the source of the water? Where's the rust in our system? We need to change those systems. We need to change those structures so that we have clean drinking water for everyone. It starts at the source, not on the outcome. So in 2020, we really pivoted our work to say, what's going to be our strategic focus on racial equity going forward? And you can see we want to really zero in on what are the experiences, not only of all associates, but particularly of our BIPOC, our Black, Indigenous, and people of color in our system. What are their experiences and how can we ensure they feel included? We also want to look at what's our director level and above, as well as our greater representation of our BIPOC associates. We know we have, and most organizations in this country have disparities in representation. What does the workforce look like? And typically it's like a pyramid. As you go up an organization, you start to see representation dwindle. So we want to create more of a rectangular shape of our representation so that it's equal across all levels. We want to work with our communities, community partners, to address systemic racism together and the impact it has on the health and well-being of our BIPOC communities. We also want to ensure that we have equitable health outcomes for our marginalized and underserved communities, and that we're increasing our market engagement with our women and minority-owned businesses, with our BIPOC communities, so that we're creating that economic driver to help erase these disparities in health outcomes. So we see achieving racial justice as something that has to be comprehensive. If you're looking at it from just one or two of these viewpoints, you're going to miss many of the structures, the policies, the data that are influencing equity. We want to look at our compensation, ensure we have pay equity, our representation, our associate experience, our associate behavior. What policies do we have in place to ensure accountability? What's our leadership buy-in, our advocacy in the community? What are the resources that we have available? What's our investment like? And how do these things influence access and the social determinants of health? We know this is a complex problem, so we need to approach it with a similarly complex approach. This is not a simple solution, and this is not something that happens just through a training or just through a survey or things that a lot of times we see large companies doing. We need to approach it comprehensively. So to start, at the beginning of the summer, we put together this comprehensive response plan to racial injustice. The first thing we did was we built a resource center on racial justice and equity that's available now to all of our associates, and we're encouraging people to leverage that information to bring it into their care, to bring it into their workforce. We have videos, articles, quotes, all types of books that help inform a person's journey of being anti-racist. We also wanted to train our staff on bias, anti-racism, and cultural sensitivity, and make sure that that training is available to all associates. We wanted to start also having dialogues to be able to have the difficult conversations around racism. You know, one of my observations over the last several years is people are having these conversations, on Facebook, and they're often misunderstood. People aren't able to really get to the root of how people are feeling. And so we're not really getting through to people. We need to be able to develop the muscle to have those critical conversations and to create a safe space for them to happen. We want to ensure that our leaders are engaging with their teams to talk about racism, to talk about the experiences of the BIPOC associates. We also want to have community conveners that are working within and with communities to help collectively address these problems. So we are training people to be conveners within the community, to work with organizations to say, what can we do together? How are you feeling? What do you think we need to do to better address these problems? We're also being a lot more intentional about our survey and listening to our associates by having deep data that we're collecting from our associates about their experience. And we're leveraging our data in unique ways now to ensure that we have equitable outcomes in our patient care. So our strategy is really has several parts to it. One, we want to have really tight communications, that we're continually engaging people in this content, that it's a part of our normal communication stream. It's not one-off communications, it's not just celebrations, it's something that's deeply embedded in our communication strategy. We also want to really build out our education and training platform. We have our bias and anti-racism seminars and webinars, our foundations of diversity and inclusion. We're also building out training on how to be inclusive with the LGBTQIA population to ensure there's equitable outcomes there. Really trying to ensure that this is deeply embedded in our learning platform. We want to, of course, have that dialogue program. In Toledo, we will be having one of these. It's an internal conversation town hall in one of our hospitals that will really start this process for the associates in our Toledo market. We're rolling out our community conveners. That process actually is starting on Monday. And so we will start to train leaders to go out and to work with these issues. We've standardized our language service access and services. And so, we understand the intersectionality of disparities. And so we want to look at the multiple ways that we're providing care to people who are deaf and hard of hearing, who speak a language other than English, so that we're providing that quality care to all of our patients. We're also leveraging employee resource groups. We actually renamed them to be ministry resource groups. And these are strategic teams that come together around affinities for different identities, whether that's our pride group, our veterans group, or people who are fighting against or addressing racial injustice. We have these groups in place that will help us activate the diversity inclusion strategy within our markets and in our communities. We've also, and I'm sure some of you may know that we're an anchor institution. We're part of the Healthcare Anchor Network, one of several large healthcare systems across the country. And our goal here is to really ensure that we are investing in our local communities, that we're hiring in those local communities, that we're looking at hiring from a multi-dimensional stance, that we need to address the social determinants and impact on employment and underemployment, that we're investing in our local communities, and that we're buying and purchasing from those communities. We want to leverage our patient demographic data to provide better training, to understand how we give better care and how we're ensuring health outcomes. We also want to ensure that we're really driving our marketing so that we're connecting to different communities, that we're broadening our scope to say we're here for all people. We also want to ensure that our D&I survey is helping us look at our progress in these areas. So we're holding our leaders accountable for achieving outcomes. We want to ensure that our care providers are trained in culturally competent care, that we have talent development programs that are promoting growth within the company, that we're training leaders to grow into those manager, director, executive level roles. And of course, our LGBTQIA training is available to all people. So we've got this comprehensive strategy for 2021 that's really looking at how these things all cut across the different pillars of our organization. Just to give you a little snippet of our data, since August 1st, we've trained over 1,500 people, leaders in our system in bias and anti-racism, directly through Zoom and webinars and in-person trainings. And even before that, Bob Baxter, the president of our Toledo and Lima markets, trained all of the leaders in Toledo in bias and anti-racism in 2019. So we were doing this work already, and we want to continue to do that and make sure it's getting to all of our associates. And not only our associates, but our providers, and that we're giving that necessary training so people are able to give culturally competent care, that they're paying attention to their biases, that we're really working on ourselves and internal peace to ensure equity. And I mentioned in the beginning that accountability, that justice piece is so essential. So we've built in hardwired accountabilities to ensure that, number one, we have deep data, that we're looking into the data and really looking at how that's impacting our associates and our patients, that we're monitoring the data frequently and not just quarterly or not just annually, that we're addressing concerns of our communities, whether that be via our surveys, our focus groups, or our patient surveys, we want to understand the experience of our folks. So, we have Press-Ganey surveys, patient experience surveys. We're going to be really working on encouraging participation so we can have an honest look at how people are feeling. And then looking at how that influences our decision-making and progress going forward. That this data is not just data to tell us something, that it's informing our work and our strategy. So for example, we've, in our human resources team, built in an accountability team for all of our leaders to be accountable for 24 metrics for diversity and inclusion, looking at our representation, our culture, our pay equity, how our managers are acting, what's our development of our associates, how is our healthcare anchor network being utilized, our anchor strategy. So we have these accountabilities, not just organizationally, but also functionally, where diversity and inclusion sits in our HR team. In addition, we've also ensured at a top level, we have diversity and inclusion metrics that we're holding people accountable for a key performance indicator. So we have high level accountabilities as well as localized accountabilities to ensure that the strategies and the things that we've set forth and that we've sort of walked through are things that people are acting upon, that we're seeing a change in results, that we're seeing equitable outcomes. So I actually sped through this talk rather quickly, and I apologize for that, but I do have now time for questions and comments, answers, and would love to dialogue with all of you if you have any questions.
Nathan, that was absolutely wonderful. We have several questions that have started to come through the chat as well as the Q&A function. But just as I'm waiting for Marla to assist me with that, let me just jump right in and ask a question, diving just a little deeper. After the murder of George Floyd, what we noticed is many businesses and corporations making a public statement, denouncing racism and vowing to do business differently. It is quite impressive to see how you've just run through really the strategy that Bon Secours has put in place. But my question really is for those businesses who want to do more than make the statement, how easy or difficult was it for leadership to move to doing something that you just spelled out? I mean, not only are you looking at making sure your upper echelon is accountable, but it looks like that is being woven all throughout all layers of how you deliver your patient care. So talk to us a little bit about that, in particular for those folks who are saying, I really want to do something, but I don't think I can, or I'm not sure that I can, or how do I really even go about starting it?
Yeah, that's a great question. When I started the talk, we were looking at how did we start our D&I framework 4 years ago? And we were able to really pivot very quickly this summer because we had the structure in place. We already had the leadership buy-in. We had already begun to develop the infrastructure, the resources. We had already been looking at ways that we can tie diversity and inclusion to accountability. So these were plans that happened before George Floyd. And so our CEO, John Starcher, was already a proponent, already had that initial buy-in to this work, and saw it as a key priority for our ministry. In 2018 and 2019, we also had key performance indicators for diversity and inclusion. And that was to stand up our councils and to train all of our talent acquisition and bias training. So we had already begun to do the work. And so pivoting in June was very easy. We were able to put a lot of focused efforts on just being a lot more intentional with the work. For companies that are saying, wow, this is really a problem, we need to do something, I think the most important thing is to start to look at what are going to be the structures and the resources in place to support the team to move this across the organization. we're fortunate. And one of the reasons why I love where I work is this is really tied deeply to our mission. And so there's a natural connection to what we aspire to be and diversity and inclusion. And so when we're able to ground it in such a way that it says this cuts across everything we do, you are able to really start to drive these things across the company. But it has to happen with people, resources, and commitment. And it has to go beyond just thinking of a training or a statement. It has to go deeper into that well to say, what kinds of conversations are we going to be having with ourselves? How are we going to be transparent and humble in our approach to really start to see the work that we need to do? In my opinion is that all companies have work to do. This is something that is deeply embedded in the fabric of America. And so we all have deep, deep work to do. And if we're just thinking about it at a surface, we're not going to look at the deeper structures that are in place that are creating these inequities, these feelings of exclusion, lack of representation, all these other measures that people are looking at. So I think you have to look deeper. You have to see how this ties to strategy and mission. And then it takes time. It's not something that's going to be stood up in 6 months and just be magical. You have to have that iterative process to keep being willing to change and pivot and create something new and responsive to the dynamics of our society.
Yeah, you said something that I think is worth repeating. If you're in it for the long haul, there is not a quick fix to this. And it certainly is much more than a statement, is much more than a pledge. And in many respects, it is even much more than saying, we're going to hire some folks that look different. It really is about making sure, if I could go to one of your early analogies, many of us have seen it. It's about being invited to the party, being able to help plan the party, being able to help pick the decorations and the music and all of that. And so we equate that in our world to really the concept of belonging. It's one thing to include people, but do they belong? Have you really created that culture of belonging? And so I think you spoke to that really, really well. There are a couple of more questions that I want to kind of get out there, and I'm going to try to lump them together. One, there's a couple of folks asking if the PowerPoint presentation will be available. And I kind of assumed, because you were okay with us recording, that you were okay with sharing the PowerPoint. Is that okay?
Let me just confirm with our marketing people how that works. But yes, I'll get permission to share it.
Okay, that sounds good. So those of you who have asked, it looks like there's several of you. Once Nathan is able to get us the PowerPoint, we will forward that to the attendees. Okay. There's a couple of folks that are asking questions about the resource list that you referenced. Is that list available for the general population or only those folks who are connected to your healthcare industry?
So the list is hosted on our internal website. It's a collection of work that is public work. So we just essentially brought together all of the resources that inform our training that I read, that our team reads and engages with, and vetted it to ensure that it really was something meaningful that helps drive change. It's internal in the sense that it's for our employees to log in and they can do their learning and their engagement with it. But it's not something that's like not able to be shared. So I would just have to think about how we can share that publicly, because it's a great resource guide. There might be a way that we can pull it into a PDF file or something to share that.
Sure, that would be great. And let me just add, I'll talk about this a little bit more at the very end of our session, but on the YWCA's website, there is also a list of resources that are age appropriate. We have some that are geared obviously for very, very young children in talking about race, and there are others for us adult learners that are, again, really ready to work our muscle in doing this work that I think will be really beneficial to you. There is one viewer who is asking a couple of questions in relationship to recommendations of books that she can share with her white friends who do not believe they are racist.
Good question. I think the best book on this is How to Be an Anti-Racist by Ibram X. Kendi. That book is, and I've read many, and there are a lot of really good books, but that book is very accessible to me because it's reflective, self-reflective. Ibram X. Kendi is a Black male. He's a professor, a scholar in the space, and he talks about his own journey and being anti-racist and looking at his own biases. To me, that's how we should approach this. This is something we all have to work on. And we have to look at it from a critical lens, a critical self lens. So that's a great starting point, I think. Probably the best in the field. I'm drawing a blank. I have some on a resource center. Oh, gosh. And, I could share it in a follow-up email because there are some that are really deeply informative. The other thing is, the problem with racism, especially institutional racism, is the structures, policies aren't naming themselves as being racist, but they are racist. And so it's like a bacteria. You don't see the bacteria, but you know that it can be infectious. We need to say the data is clear. These inequitable outcomes are real. They cut across all of these areas. And we have to trust the data to say, we have a problem. We need to take that deeper self-examination, put a microscope over our sample and say, yes, we have areas where we need to improve. And that's where that deeper internal work comes into play. And I would also say this is a muscle. And it's a muscle then in the sense that you don't wake up one day and bench press 300 pounds. You have to gradually get there. And so I often approach those conversations with people delicately, not delicately, like I'm not going to talk the truth, but saying, here's where we are, here's where we need to go in this conversation, that not everyone's going to be at the same part of their journey as I am. And so having that understanding, that gap understanding is an easy way of saying, okay, let me show you some data. Let me provide you this resource. Let's watch this video and talk about what that means and how we can start to inch people forward in this conversation.
Mm-hmm. So here's a follow-up question, just in terms of how you have rolled this out in your healthcare system. How has employees really taken to coming into the realization that they themselves may have had racist tendencies, and all of a sudden really just embracing the notion of, I've got to learn a whole wave of things that I thought was one way that I realized was a thinking error. That I operated under stereotypes, and that some of my behaviors and my actions have contributed to racist innuendos. And so I ask it from the perspective of, I've found it always challenging for people in particular who are in helping professions that set out to help all people because they're good people. And because they are good people, they struggle with the realization that, oh my gosh, I've done something that has perpetuated the harm. So talk about that a little bit, because it may also kind of help the person that asks the questions about how do you really address that with friends.
Yeah, it's a really good question. I think it starts with modeling, and even in myself, that I've had my own misconceived stereotypes and biases, that no one's immune to this. And I think once we start the conversation with, this is a problem that everyone has, regardless of where they are in their journey. There's no end point to it, that we all have to exercise this muscle. I also think that it comes with creating a safe space for people to talk about these things, but in a way that's not creating more harm for the impacted folks. So if we're talking about racism and we're saying, well, I don't believe it, and that's just nonsense, then we're saying, okay, let's back up. Let's explore why you think that. Let's get to the root of where that's coming from. There's one that just popped up, white fragility. These are things that you have to be able to approach it with a way of asking questions instead of always giving answers and say, tell me, why do you think that? Oh, there's a lot of racist thinking around job loss, right? And ethnic minorities have been blamed for economic failures. And that's really just not the case. The data is very clear on that. But people have a deep belief about that. So when you're approaching people about these things, you have to meet them where they are and say, let's look at this information and bridge that gap. But it has to be in a constructive way. I think blame and labeling turns people off. And so one thing I say is most people have racist beliefs, attitudes, behaviors that they've done or thought. That doesn't mean everyone's a racist. The label of being a racist is different than having done something racist. Some people are racist. They prescribe to racist ideologies and they know it. But a lot of people are good people and they have beliefs that are positive and good intentions. So you have to say, where are these not matching? Because we know that they exist, and how can we bridge that divide? And this isn't one training or one conversation. It's got to be continuous dialogue and fostering. It's a garden. You have to continually till it and water it for those flowers to grow.
Absolutely. I love that. Okay, chat box and Q&A box is going crazy. Let me try to catch up with some of this. As Mercy works through with donors and partners in the community, how do you navigate this conversation with donors? Looks like a part 2 to it, especially when there are often many gaps in understanding with some of the donors and those being served.
That's a good question. I think part of our strategy is to have that internal leadership in this space, that our donors, our boards, our community organizations, we want to influence positive change and be a voice of racial justice and equity. So with donors specifically, I can't answer that right now, but we are engaged with our foundation. Our foundation has been through our diversity and inclusion training. They understand these principles, and figuring out the strategy from a foundation standpoint is the next step for us, for sure. For example, there's something in foundation where you look at the data, and a lot of people make assumptions that communities of color, Black, Hispanic, Asian, what have you, don't give as much as white communities, and that's actually false information. So once we start to demystify some of these perceptions, that there's a lot of giving in those communities, and they give in different ways, they give for different reasons. There are high income earners in those communities that want to contribute and donate. That once we start to pivot our thinking, we can engage people differently. So there's multiple things in that regard. And then there's, how is the foundation thinking with an inclusive lens about the giving, the other end of it? How is it influencing our care? So a lot of our foundation dollars go to providing care to people and supporting underserved people's care. And so we're placing that lens automatically through our mission. But I can say it's been our part of our training platform over the last 3 years, and it's something we want to continue to engage with.
Awesome. That sounds really good. Here's another question for you, Nathan. Is there anything geared toward the general community learning cultural differences and bias? The writer goes on to say, I believe educating the community is a huge part of being able to identify and begin to diminish systemic racism locally, which could lead to a larger scale.
Yeah, that's a great question. I mean, I think we want to be a part of that training. We're a healthcare system. We want to work with companies and organizations like the YWCA and other community-facing companies to support the work, to be part of that education and training, to be a part of community conversations. We are not the only voice in this space. And so we are mindful that as we enter these spaces, we don't want to dominate and, be the savior to this problem. It takes everyone. We're not that player. So, conversations like today, and I've had others around our ministry where we are providing a level of education. It's just not specifically as part of our employee training, but certainly as our community conveners go into the markets, that's going to be a part of the solution, that we work with community organizations to help deliver, help support, and help see through. There's a lot of great thinking in this area, and we're here to be a part of it, to help with the leadership and to help with the support.
Mm-hmm. Wonderful. And I will share toward the end of our time together a couple of things that the YWCA is working on that will also address some of your question. I think that came from Mr. Myers. So let me try to get a few more of these. And, one of the things that would be wonderful if Zoom would do is give us the opportunity to see them all, so I can do some combining. So it looks like we're going to go back and forth here. So let me ask another question relating to just how, again, you rolled this out. What are the greatest challenges for leadership teams to hire qualified persons to balance diversity?
Great question. So there's actually several parts of this strategy. A lot of times people say there's no pipeline of people of color for these different positions or what have you. And I say, actually, I think we need to rethink that metaphor. We are the pipeline. We're the structure. So if we say there's no pipeline, what are we doing in our pipeline that's creating barriers? Because there are lakes or wells of people of different backgrounds that we're just not tapping into. And so we have to change our thinking. So part of that is to say, we need to ensure all of our talent acquisition, our recruiters, our onboarding specialists, our executive talent acquisition is trained in bias. We implemented an equity lens that encourages our recruiters, our talent acquisition, our hiring managers to look at candidates with an equity lens so that our own biases aren't impacting our hiring decisions. We did this in 2019. We started this and we saw a 3% increase in representation with small changes like that. So it's shifting our thinking. The other is, if anyone is into fishing, I love to fish, but I'm not very good. But I know that different fish have different conditions of which they swim, what bait they like, where they are in the water at different times of year. Bass are typically lower in the water when it's cold and they start to come up the water. So you fish differently for bass different times of year. People are the same way. We're dynamic. We're different. So we have different things that we're looking for and that we need. So we have to change our tactics on where are we recruiting, what time of year. For example, we got some information that an Association for African American Physicians meets in November. If we're doing our recruiting for that group of people in January, we're missing the convening where the recruiting would happen. So we have to change our thinking and say, okay, maybe we need to be setting our agenda a little differently and fishing where the fish are, fishing with what the fish want to fish with. The other thing is you have to create the conditions for people to stay. And that's why I say you have to have that equitable environment so people are included and supported and valued to be their full self. So we have to have this structural mindset to say we need to do these things internally to ensure that the experience, the career development is in place for those individuals when they come here. Mm-hmm. And the final thing I would say is it has to be tied to accountability, because you can't do quotas or anything like that, but you can say, you're accountable for reducing your own bias. So we've got organizational KPIs, key performance indicators, that are holding our leaders accountable for being inclusive in their hiring and driving representation. So we're going to hold ourselves accountable for that change. And so I think it's multidimensional. It looks at our tactics, our training, our compensation, our environment, and our accountabilities to achieve that.
Mm-hmm. I just saw another question, and you've kind of touched on this, but you maybe want to go a little bit deeper. How have you been able to identify measures to track outcomes versus outputs?
So that's where, part of our data strategy for our associate experience, for example, we did a survey this year of 60 questions to ask about experiences of inclusion within our ministry. So that is a very large survey in this space. Typically, there are 5 or 6 questions embedded in a survey that touch on inclusion. And we oversampled our BIPOC associates, meaning we wanted to look at comparable data, but we wanted rich data from BIPOC. And so we got really rich data that showed where we need to improve in our inclusion. We are going to be measuring that change year over year to say these actions for training, these actions for strategy are impacting the associate experience. Similarly, with our patient experience, we're systemizing our patient experience data because we're a large healthcare system. We collect it in different ways in every market. So we're systemizing it and going to set the same baseline data to grow that experience, those experience outcomes. Because it really, you can measure people's thinking a little bit, through some of these, like the Harvard Bias Association test. But the thing with bias is it changes, it fluctuates back and forth. You have to look at how people are actually behaving and what's the change in their behavior. And so we want to look at those outcomes. We're also looking at tangible things that aren't just associate related. What's our retention and turnover rates by race, ethnicity? What's our pay equity by race, ethnicity, and gender? What's our representation in hiring? So seeing those actual tangible results change over time. So that's where our 24 metrics come into play, that we have these things in place that we're measuring on a really bi-monthly basis. We're pulling that data and we're looking at it continually to pivot our strategy. So we want to look at it short-term and long-term to see what those experience and outcomes are.
So Nathan, it might be helpful for anyone that joined us late just to give us a really quick update that you shared earlier in terms of how you came up with the 24 point matrix and who was involved in the team that had put that together. There's a couple of questions here about, how to do it and, who is holding folks accountable, that sort of thing.
Yeah, that's a good question. So we have a chief diversity officer. Her name is Odisse Stapleton. And the way that our HR team is structured, we have a chief that reports to our chief human resource officer, Joe Gage. Joe Gage has been a big advocate for this work and has said, this is a priority for us, for every part of our HR strategy. And you are now challenged. So our team, Odisse leading it, myself, worked with the different leaders to say, these are the measurements for your function area that you're going to be accountable for. So they're accountable to the leader, and we share that with our board and our CEO. So we have this accountability at all these leadership levels to say, here's what we've set out, here's what we're agreeing to, and we're going to hold each other accountable. So the different areas of HR, benefits and well-being, pay equity, representation and hiring, associate experience, talent development are all part of that 24 metric family that our leaders in HR are ultimately held accountable for. So it's a good system because it's saying it's not just going to be talent acquisition. We can put a lot of weight on that, but at the end of the day, if you're not creating those structures in place to support people, we're going to have turnover. People aren't going to grow in their careers. It's really multifaceted. So, I feel very fortunate that we have really strong leaders in this space that aren't D&I leaders, that are saying, this is a priority, we're going to do this, go forth and do it.
Mm-hmm. Sounds great. Another question, where are you in all your relation to well, I'm trying to see. Okay, so I think what the writer is trying to ask is, where are future physicians and nurses at in their training in regards to the curriculum process?
Yeah, good question. So we have it available to every associate, but we're also adding what we're calling a clinical training for our physicians and nurses. They have different demands in terms, they're not a computer warrior like myself. I can do all the trainings I need. They're on the floor. So what we've done is we have this 1.5 hour long bias and anti-racism training that we're segmenting into 3 parts, and we're weaving it into meetings, into digital formats, videos and things, so that it can touch people at different points of their development process. It's a part of the learning strategy and platform. So we are reporting on that as a priority. What's our clinical engagement in the training? And so we're going to be tracking that progress. So it's a priority for us, and we're just trying to meet the care providers where they are, because they're in a pandemic, they're working insane hours, and they're masked up and burnt out, and we want to be able to meet them where they are with the training needs. So instead of asking them to sit down for 1.5 hours multiple times a year, we're going to have this truncated out so we can get to them as well.
Mm-hmm. Okay. One person wants to know, how are you addressing disparities in relationship to the COVID vaccine delivery?
Yeah, so that all healthcare systems are asking this question, right? And we've seen 2 disparities. One is in how COVID is impacting those communities, Black and brown communities, and the vaccination rates. What we're seeing is, what we believe is, vaccination or lack of participation is really a matter of trust in our healthcare systems. Trust that was broken with the Tuskegee experiment and other things that have happened in healthcare over the last 60, 70 years or what have you. So it starts with trust. It starts with representation of people getting the vaccine, and really being open to the feedback from those communities and saying why they're hesitant, and saying, how can we address this with you, not just forcing it down your throat, and really inviting people into the conversation. We know this is a hard time, and there's lack of trust in the vaccine overall. And so we need to really understand those voices. So we work with our marketing and our communications team to really develop campaigns that are listening to the communities, that we're pulling in our community health team, our clinical team, to really think about this in a different way. But really it comes down to that trust, and that's what we have leaders that are working on that and saying we need to listen and we need to hear the challenges that this community sees with taking the vaccine. It's a tough issue. There's not a clear answer. So, this is a tough time for everyone, but really getting that trust is something that we need to continue to work on.
Absolutely. And just as a follow-up for the person who asked that question, there is a community collaboration that has been formed under the leadership of Sean Savage of Savage and Associates, termed Project Victory. And the whole purpose of it is to bring the community together, get us on the same page, to help educate everyone about the importance of the vaccine. There are a variety of different subcommittees that have formed. I'm pretty certain Mercy St. V's is a part of those committees as well. I am a part of the nonprofit sector. I know we have hospital representatives in the healthcare subcommittee, education track. I mean, we are trying to focus on as many in the community as possible, and the best method to get in front of them to, one, provide the information, dispel any myths, but more importantly, help them understand how the vaccine has been put together and how effective it is. I find it equally of importance to make sure that we are identifying really who the trusted people are. And I think Nathan really spoke well to that. For some people, the trusted source is a healthcare provider. but not everyone goes to the doctor on a regular basis. So we need to make sure that we are identifying who that person trusts, who they listen to. And so in our health equity committee just the other day, we were saying, maybe it's getting to the basketball coaches, maybe it's talking to the hair salons and the barbershops and wherever people congregate and have a tendency to believe the facts that come from wherever that source is. So the Project V committee is really working to make sure that that information gets in the hands of the right people so that we are prepared to gain our herd immunity, at least in Lucas County. So that's just one little extra tidbit I thought I would share. We have a lot of questions, Nathan. So I'm just going to kind of keep going with these.
Please.
There's a person, Sandra, who says, I'm in a position to hire new staff, and I am leaning strongly toward hiring an African-American staff member with the mindset of the population we serve. I want to say thank you for reinforcing in your presentation. My question is, how do we start having this conversation within our agency?
I think representation is critical. And the thing about this whole conversation is we have to debunk myths about professionalism, about exceptionalism, being, biased or against people of color. When we start to say, no, really, these individuals are greatly qualified, they bring great gifts, talents, and attributes, here's how we know. You start to change the narrative. Instead of, some people think, oh, it's because they're Black or it's because of this or that. No, they're a great person, they represent the community, but ultimately it's their job, their exceptional educational background, their great career, whatever the criteria are. But representation is only a part of it. And you have to be engaging in these conversations all the time. And what I want us to push representation, but I also want to push on those systems or structures in place. Because what we don't want to do in this is create more harm for people of color. So when we say we're going to really commit to diversity, if we don't create that environment where people are mindful, we have what's called the 3 V's of inclusive values: value, validate, and voice, where we want our associates to voice or to value the diversity in all people and to say it's valuable, we appreciate it, it brings something unique to the ministry. To validate the experiences, to say, when we hear someone say, I don't feel included, instead of getting defensive, we're saying, I hear you, I'm listening to you, and I'm going to make an intentional effort to change that. And to voice, to say, when we see behaviors or attitudes or beliefs that are against our values of inclusion and diversity, then we're going to speak up against it. We're going to address it. We don't have to do it unprofessionally. We can do it in a way that's saying, hey, I heard you say something. Can we talk about that in private? Because you need to have that environment in place for diversity to thrive. So we got to do this all at the same time. We don't have the time or the luxury to say, well, first we're going to fix our environment, then we're going to hire diversity. But you don't want to bring people into a harmful place. So you have to do a lot of that internal work to build inclusive behaviors, to hold people accountable. And, just a good example for myself, and this is, as a practitioner, I have to be thinking of these things myself. I'm on the school board here for my kids' school, and we did a differences dialogue training. We had all these great questions. We were talking about how to be an anti-racist. And we did this all on Facebook and what have you. And what we realized is in the planning, we got feedback that our planning of it wasn't inclusive. We didn't have a Black woman on our panel helping us to plan. That was an immediate learning opportunity to say representation is critical. And sometimes we're not aware of ourselves when we're being exclusive. So I had to say, yeah, you're right. I did not do a good job with that. I need to reset and bring in the right people to have representation, to be able to look at this from a different lens, because we just can't. We shouldn't think we can answer everyone's needs. We need to have representation there to help us see things differently. And diversity is beautiful. And when you have diversity, you see the world in a whole different way. So, it's structural, it's mindset, it's behavior change, and all comes together.
Absolutely. It is important, again, just to keep reminding people that it's a work in progress, and there are no easy fixes. It is much more than just saying let's hire someone that looks different. But I think part of what Nathan has shared with us all throughout the hour that we've been here is that creating a space that allows for courageous conversation is really one of the main principles that should occur. Making sure that you begin to address the culture that already exists, so that when you're ready to hire that very qualified person that is different, that person feels like they belong there, and are able to use the skill sets and the talents without question or without pause or without feeling as though they've been brought in and tokenized. So I love the way Nathan's answers just keep going right back to that main premise. And if that's something that you walk away from in this session, then you've heard well, because it really starts there. There's another person who would like you to talk a little bit about how you do this from an earnest and deep level. Sometimes we see efforts to check the box is really where this person is coming from. Also, what are talking points you would recommend to push past through the propositions that we have diversity in experience, such as attorneys or bankers, for an example? I'd like to move into a discussion deeper, but we're kind of stuck here.
Well, so there's two parts to that. The earnestness comes from self-work and comes with humility and grace. I think as leaders, what we need to do is take a deep look at ourselves. I have to do it all the time. It's painful, it's hard, and you have to acknowledge the mistakes that you've made. And you have to do that deep reflection. And it comes with time. It's easy to make a really beautiful statement. It's not easy to really embed this into an organization. It takes time. There are other priorities, other things that are impacting a company. And so you have to think of this as a long-term plan. You have to show grace in the process, that you don't come to the table saying we've accomplished everything or we're already there, because you're not. And it's, I think, a misstep to think that any one company has all of these things answered. And so you have to have that approach as an organization, as an individual. As far as that deeper question with diversity, of thought or of experience, that's why if you look at our definition for diversity, we say diversity is the existence of the gifts, talents, and attributes of people, processes, and functions, characterized by both differences and similarities. Those experiences, those thinking, preferences, cognitive diversity do matter, and they are really important. They are not, however, the source of great inequality. And so when you start to say, what's our stance on racial justice? And you say, look at the disparities based on race, it's the structure that's creating those disparities based on race. It's not me talking about it, it's not people calling it out, it's the structures. So we want diversity in this full, rich sense of the word. But when we have populations of people that are discriminated based on the skin color, we have to acknowledge that. That is something that is our Achilles heel as a country. And we keep tearing it, and we're never fixing it because we just kind of say, well, we're better, and we keep walking, but we keep tearing. We need surgery and we need to wear a boot for a long time to heal this wound. And, I love the idea of cognitive diversity and diversity. I think it's really important for how we work together, how we bring those gifts and talents to the table. But if we're not acknowledging the areas where we need to improve, we're never going to erase these inequities. So that's my thinking on that. And that's why that definition of diversity is different than representation. It's different than the conversation on racial justice.
I think we have time for one or two more questions. Let me see if I can't roll a couple of them together. How would you address privilege? The writer actually says she finds that it is a trigger for white people.
Yes, it is embedded in our training. We talk about white privilege. I think the way that white privilege is often talked about, sort of in the broader context, turns people off because they say, well, I've had a hard life. I've had to work hard. I've had disadvantages. And what we're saying with white privilege is all people have challenges in their life, but not all people have them because of the color of their skin. And when we start to say, you have white privilege, meaning you don't have some disadvantages because you're white, you might have them socioeconomically or what have you, but not because of the color of your skin. When you start to put yourselves into the shoes of a person of color, a Black person walking in the streets of America, it's when you start to change that lens and say, well, have I ever been followed home by a police officer? Have I been followed around a store when I'm buying clothing? Has anyone ever questioned my ability to pay for something? Has anyone ever questioned my credentials? When I'm in a meeting, do people speak over me? When, all these multiple examples of where that privilege really plays itself out. I think the conversation on white privilege too is important, but I think what we need to look at are those structures again. That's a result. That's again looking at the water. What's creating these disadvantages? White privilege is important on the one end of people being reflective of their privilege and thinking about it, but we got to change those structures. They're creating these disparities. That's where my mind is, that well.
Absolutely. You said that well. You said that well. Let me stick this question in and see if you can give us a short snippet of an answer so I can get our viewers back to work and on their next Zoom call. Yeah. But I love this question. It comes up often. And so I'm going to read it in its entirety. Most people who say I have a Black girlfriend or boyfriend, so I am not a racist. Or they say I have at least one Black friend, so I am not a racist. I really don't agree with this statement, as I have seen the same people say stupid things about Black people. Can you address this?
Yeah, I think this comes back to that point I was making around unconscious bias and what it means to be racist and anti-racist. So in a person's heart, they may not believe in inequalities or racism, right? They may say, no, all people are created equal. I believe that. But then there are these unconscious biases that people have towards people of color. It doesn't matter about your relationships. They are formed, they're in your brain. Just because of a relationship with a person or two doesn't make you not racist, okay? The issue, I think, is also the labeling of racist. There are people that are racist, like as a label, and there are people that have behaviors, thinking, attitudes that are racist, even though they don't prescribe to that ideology. We have to draw that line and say, we can describe the behavior and the attitudes and see it as something that can change and something that we're critical of without labeling people a certain label. I think that's where that line has to be crossed. There are some people that really fundamentally believe in racist ideology, and we can't ignore that thinking. There are a lot of good-hearted people that say, I'm not racist. I'm going to say, that's not enough. We want you to be anti-racist. We want you to critically examine yourself. We want you to stand out against it. We want you to check yourself when you say something that's racist. So not racist is not the same as anti-racist. And that's the journey we need to get on.
I love it. Okay, so for the viewers, let me make you this promise as long as Nathan is okay. There is no way we could get to all the questions. I apologize for that. And Nathan even ended his presentation early, but I love the interaction. It really shows that you were engaged and are really hungry to get this information out so that you will be able to move and navigate in this space. One of the things I hope to do is share the questions with Nathan, and maybe when he has an opportunity, he can respond back and we can forward the question and answers out to those individuals who tuned in for this session. So if I can get Nathan to do that in his spare time, I would greatly, greatly appreciate it. I want to spend just our last minutes on the phone just making a really quick plug for the YWCA. Several things that came up throughout the course of today's Lunch and Learn session can be addressed in some way, shape, or fashion by going to the YWCA.NWO.org website. I mentioned we have a whole list of resources that are there and available for you, children, your workers. We actually also do book discussions. We do them twice a month. There's a whole set of books that we've been reading and discussing really for almost the last 6 months, and we have it scheduled through the end of the year. And then I also want to call your attention to the 21-day Racial Justice Equity Challenge. We actually launched this twice several months ago. We have new material. We're launching it March 1st, and we are encouraging our community to join the challenge. It is really simple. For 21 days, the YWCA will send you a link that will have a list of resources, and you get to choose what you want to read, what you want to do. It could be something as simple as reading an article that takes 5 minutes or watching a podcast that takes an hour. For 21 days, we want to change and form some habits. And we believe if we follow the scientific rule, it takes about 21 days to break a habit or to start a new one. If we get out there again, Nathan has said it, I've said it a couple of times, this is about exercising a muscle. Some muscles have been dormant, some muscles just need a little tweaking, but we want our community to begin to embrace this notion of racial equity and inclusion for all. So there's just a ton of things that are starting to happen. I think as the months roll out, I'll be able to share a little more information with you regarding a group of folks that have been working with the YWCA to promote racial equity across all sectors of our community. The Toledo Black Agenda was crafted and is also published on the YWCA website. And I invite you to join us again this time next month for our next Lunch and Learn. Nathan, it's been a pleasure talking with you. You have a wealth of information. It's just been a joy. Thank you so very much, Bon Secours, for allowing you to take some time away from your busy schedule and join us. Everybody, thank you and have a good rest of the day.
Thank you.